Okay, so how do you know you need a root canal? There's several symptoms that can indicate why you need a root canal. One is if you're drinking something hot or cold and your tooth starts to hurt. It starts lingering or aching. That's a big indicator. Another one is if you're chewing on food and it starts to hurt and you have to avoid the side. That's another indicator that your tooth may need a root canal. And one of the main indicators that I notice that patients always tell me is that my tooth just hurts. It just aches on its own, radiates to my ear or to my temples, or I'm having to take pain medicine for. These are all indicators that the nerve or the blood supply in your tooth is inflamed and it needs to be taken care of. Sometimes there are no symptoms at all, and that's why we recommend that you go to your dentist every 6 months to get x-rays done. Because what happens is when the dentist or your endodontist looks at these x-rays, he sees if there's any kind of infection in the bone. And those are big indicators that there's infection in the tooth that's leaching out into the bone, causing any kind of swelling or symptoms. Because sometimes what happens is you may not have any pain, but you'll notice a little swelling on the side of your cheek or next to your gums, or a little pimple there. And that's a sign that there's drainage and there's active infection. These are all indicators that you may need to get a root canal done. So it's always nice to go in and get checked up by your dentist or come to a specialist. All right, so what are my options if I need a root canal? You always have options. You have the autonomy to choose what you want to do. One of the options is to get a root canal. Another one is to do nothing. And the third is to extract your tooth. If you do nothing, your tooth will eventually become more infected. You'll probably develop symptoms and pain or swelling. And at that point, you'll probably have to do something. The other two options you have are to extract your tooth or to have a root canal done. Okay? If you extract your tooth, at that point, you're going to have a void in the area. And so you have several options on how to replace that void. One is to do a bridge or a partial. And that involves anchoring onto adjacent teeth. And by doing this, so you put unneeded stress on these teeth, which will eventually end up needing crowns, root canals, or end up needing to be extracted, because that undue stress is more than those teeth are able to handle. The other alternative is an implant. Implants are great. If I had a missing tooth, I would want to put an implant there. That involves additional measures, though. When you have the tooth extracted, a lot of times the bone is deficient in the area due to infection. So they have to augment bone in the area and do additional surgeries. Then they have to allow that area to heal, and then you have to have an implant placed. This whole process can take anywhere from 6, 8 to 12 months. Okay? The other alternative is a root canal. Now, as I've spoken before, root canals are very efficient, take about an hour to do, one appointment, and they have a great success. With today's technology, they have about a 94% success rate. Are root canals painful? No. Root canals are not painful, and they should not be painful. Okay? With all the armamentarium that we have today, we can make sure that you are numb and relaxed without pain when we work on you. It should be no different than getting a filling or a crown at your dentist's office.